Hello, I'm Rhonda Shepard, Training Center faculty for the American Heart Association Training Center for the Allegheny Health Network. Today I'm going to demonstrate for you an adult CPR resuscitation. But before I do so, I'd like to talk about some critical concepts to consider. Let's talk about scene safety. What is scene safety and what does it mean for us as healthcare professionals? Scene safety is more than just about the basics, the slips, trips, falls, and sticks, things we talk about regularly. We need to think on a broader perspective. Who's in the patient's room with this patient? Is there something going on in there that makes me uncomfortable to enter the room? Please, when you're assessing scene safety, make sure it's safe for you. When I approach this patient and I want to assess for their alert status, I'm going to shake and shout. Hey, are you okay? The moment I determine they're unresponsive, that's when I call for help. If I'm alone, I may need to leave the patient to activate either emergency response system outside of hospital or calling for help inside the hospital. If I have others with me, send them to call for help while you continue with your assessment. When I assess for breathing and a pulse, I want to complete these tasks simultaneously. So I'm going to completely expose the chest. I'm going to assess for a pulse on the side that I'm on, and I'm going to watch for chest rise and fall. If I'm not sure if I'm seeing chest rise and fall, I can place my hand on the chest to feel for chest rise and fall. If I don't see or feel either, that's when I begin with CPR, starting with high-quality compressions. What does a compression look like? What should we be trying to achieve? Let's talk about hand placement first. We should be placing our hands on the lower half of the breastbone, centered between the nipple line. Try to focus your energy on the heel of your hand. Interlace your fingers if you can and pull them up as far as you can. This minimizes the impact point in which we deliver compressions. We need to focus on a good depth. So how deeply should we be compressing on the chest? We want to compress it at least 2 inches. If we have a feedback device, we should be striving for 2.4 inches. What is our rate of compressions we should be achieving? So we should try to be compressing at no less than 100 compressions per minute and no more than 120. That's our appropriate range, 100 to 120. Remember that recoil on the chest, or the upward motion, that chest coming back to normal resting, is also critical. So that upward motion is just as important as that downward motion. When the AED arrives, we want to use that as quickly as possible. If the person bringing the AED to you is familiar with its operation, they can apply the electrodes around your hands while you're compressing. If the AED arrives and there's no one available who knows how to use it, you may have to stop your compressions to use the AED. Remember your compression to ventilation ratio of 30 compressions to 2 breaths. For the adult victim, it doesn't matter how many rescuers you have, you remain at that ratio. When using a bag valve mask assigned by the Allegheny Health Network, make sure your PEEP setting is at 5. 1, 2, 3, 4, 7, 8, 9, 10, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Good chest rise. Good chest rise. 1, 2, 6, 7, 8, 9, 10, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30.